You can hear me? So I want to thank you guys for being here both in person and online. Tonight's talk is symptoms and how they lie. For those of you who are here in person, if you have any questions, ask at any time and I will interact. For those of you online, the perk of being here in person is you can ask the questions online. You're just going to hear what I'm talking about. So with that being said, I want to thank you for being here, because being here is not just about you. Yes, we're going to help you. Yes, we're going to help you figure out how to help yourselves, but we're also going to teach you how to help others. Because my goal with these educational workshops is to teach you how to actually inform others to make wise decisions. Why I bring this up, research study out of University of Pennsylvania. Did you hear that? Yep. Showed that the #1 cause of death or mortality is poorly made decisions repeatedly. So we want to help you make wise decisions. So those poorly made decisions can then lead to bigger problems. And that's what we're going to be talking about today, is the different things, how they affect you, and so forth. So first off, we're just going to start with a simple story. So let's think about if we all go out and we're all going to get some sushi, and we're going to go to the store or go to the restaurant, and we're all going to eat sushi and we're all going to come home, and I get sick. I get deathly sick and I start vomiting and so forth. And let's say the other person that was there is Sarah, and she doesn't get sick at all. We all ate the exact same foods. Based on those symptoms, who would we say is actually sick? Probably the person with the symptoms, right? But I want you to question that, because if we and that has, let's say, salmonella in it, the person who is removing the salmonella is actually the healthy one. And the one who is not is actually the one who is sick, because they're allowing that toxin, that endotoxin, to get in. And with salmonella or food poisoning, it can be bigger than you are aware of. So I'm going to go down a little tangent and then I'll come back. With food poisoning, you actually can be exposed to gram-negative bacteria, and these bacteria can actually lead to chronic inflammation. It can break down your gut. It can lead to anxiety, depression issues. They can lead to chronic pain issues. They can lead to autoimmune issues. So being exposed to salmonella or E. coli is actually a bigger problem than you're aware of, because it will kill your microbiome, so you lose all your gut, but it will actually destroy everything that helps you stay healthy, which is that gut microbiome on top of the brain function. But if you weren't responding correctly, you'd have no symptoms. So how we feel does not tell me how healthy you are. It's how we actually function. If you're exposed to a toxin, you are supposed to get a fever. You are supposed to get chills. You are supposed to get the sweats. You are supposed to have these responses. Why are we supposed to have these responses? Most people aren't aware that when you are in a state of being infected, the bacteria or virus that you're infected with can only live in a small temperature zone. So by you increasing the temperature of your body, it actually slows the reproductive rate of those bacteria or those viruses, thus making them slower to actually take you out. So if you have a high fever, you're actually slowing down the response rate. You'll also move the blood through your body quickly. So when you move the blood through your body, because your heart rate's up, it will allow the different white blood cells to actually destroy the bacteria and the viruses. So the symptom of the fever tells me that you're actually healthy. The symptom of not having the fever actually tells me that you're sick. If you've been exposed to, like in our story, say salmonella or E. coli or something that actually was poisoning us. When we look at this, when we have people that are being taken care of by, say, me co-managing with, say, a naturopath or medical doctor or so forth, if that person has a really severe thing like a cancer, The thing that actually tells me that they're getting better is that when they're exposed to a cold, is they actually express health. They actually get a fever. They get high temperature. They get the chills. They get a runny nose, because that means their body is actually working correctly instead of not. So how do we tell if somebody that has, say, cancer is healing? When they get exposed to a rhinovirus or a cold, they actually express symptoms. So the symptoms tell us the nerve system is actually working correctly. If you don't get symptoms, it means your body can't actually destroy or get rid of those bacteria, viruses, and so forth. Is this making sense so far? Perfect. So let's look at some other things that are going on. So when we talk about the two leading causes of death and disease in North America, what are those two leading causes? Any ideas?
Heart disease.
Heart disease and cancer flip-flop, back and forth. Are those diseases acute onset diseases?
No.
The answer is no. That means, do they happen quickly? No. Heart disease and cancer are not a quick thing to make. They literally take decades to grow. And I want you to be aware of the three major factors that are going to drive somebody towards heart disease and cancer.
Smoking.
So one of the answers was exposure to chemical stress. The person said smoking. That can be one of them, but we need to understand that there are underlying ones that are even more sinister than being exposed to smoking or radiation or things like that. There are other issues that will actually drive heart disease and cancer quicker than being exposed to a toxin.
Diabetes?
Hey, you're not allowed to give away all the answers. I'm just kidding. No. So one of the answers was diabetes, and the answer is yes, sugar is one of them. So yes, I've been teaching people well, so that is one of them, and we'll get into it. So the key factor when we're talking here is, what is something that if we have it in a high enough amount will stop chemical toxins from actually causing us to get sick? And the answer is glutathione. Glutathione is a naturally made antioxidant in our body. Glutathione's job is to manage stress, chemical, emotional, and physical. Glutathione is a molecule that will heal any cell that has been damaged. Let me say that again. Glutathione heals any cell that has been damaged. That means if you have low glutathione, you cannot heal your body. If you have high glutathione, you can literally heal your body. So the glutathione is used in the liver to detox you. So if you're exposed to, say, benzene from like smoke coming or exhaust coming out of a car, or you're exposed to cigarette smoke, or you're exposed to gas fumes, glutathione is literally your body's way through the phase 1, phase 2 of the liver detox pathway that actually removes toxins. So if you have enough glutathione, that's the get out of free card. That's the, in naturopathic medicine, they call it the what's the word I'm looking for? The young supplement, or the young pill that you take. It actually slows aging, because aging is cells not reproducing correctly and decaying. But with glutathione, you can actually slow that process by restoring the cells and helping them stay healthy. So the glutathione is going to remove all those toxins. The glutathione is going to help any part of a cell that has been damaged. The glutathione will also heal membrane linings and remove free radicals. So what are free radicals? They're those extra energies, or not extra, they're the part that actually comes in and steals energy from cells and causes them to die. So a free radical is basically a molecule that wants to steal an electron so that they can be stable. And in doing that, it will make the cell or the membrane or whatever it touches where it steals that electron get sick and die. So what is the takeaway from what I'm telling you? Glutathione is a really good substance for you to take. It is one of the liver detox pathways. It's the glutathione pathway. You also have the B vitamin pathway and the sulfur pathways. If these are all working correctly, you move toxins. So if you want to stay healthy, glutathione is going to be your thing. So what are the things that can set us up to get heart disease and cancer? The number one thing that we need to look at to make sure that our body is healthy, and most people have no clue what this is how much oxygen do you actually have in your body? This is why we put that little pulse oximeter on your fingers, but we put it on both sides. Because we want to see how much oxygen is actually on both sides, because it doesn't stay the same. We've had extremes where the right hand is at 92 and the left hand is at 98. Anything below 97 at this altitude is actually inflammatory. That's scary. If you're at sea level, you want to be at 98 to 99%. We commonly have people come in with oxygen saturation levels in the low 90s, 92s, 93s, and they're wondering, well, why do I have chronic pain? Well, why do I have memory issues? Well, why do I have anxiety? Or why do I have depression? Or why do I have these hormone problems? And literally the number one thing that will cause chronic inflammation is low oxygen. And if you don't understand, chronic inflammation is what drives heart disease. It's what drives cancer. It's what drives neurodegeneration. It's what drives your degenerative issues. So you need to have high oxygen levels if you want to stay healthy. The next thing that we need to have under control, and like our peanut gallery said, is blood sugars. So we don't want, and that's not negative, I love my peanut gallery here. We don't want to have high blood sugar levels. We want to be able to absorb sugars so that we will react correctly. Do you feel symptoms when you have high blood sugars? No. Do you feel symptoms when you have low oxygen? The answer is no. Most people have no clue these problems are going on because it's a steady, slow, degenerative process that's leading to this. What are things that can drive you towards having high blood sugar problems? Consumption of processed food is number one. So if we're taking any of our processed oils, that's canola oil, that's rapeseed oil, that's peanut oil, that's vegetable oil. If you're eating any of those oils, it's actually destroying your cells. It's toxic to your body.
Is olive oil?
Olive oil is a positive one. So the three well, there's four positives. The positive ones are olive oil, avocado oil, lard, and butter. But if you have autoimmune, don't touch butter. Because butter the casein in butter can react, and it has cross reactivity with gluten and celiac issues a lot of the times. So if you want to be safe, olive and avocado are your best friends. You can also have coconut. I know a lot of people have talked about it, but it's actually very positive. So the oils that naturally come out of the plants easily, those are good. The ones where you have to actually press them and use a lot of physical and chemical changes, like corn oil, canola and all this stuff, those are very toxic to you. And why they are is they're high in what's called omega-6 fatty acids, and those are actually inflammatory. Omega-3 are not. There's supposed to be a ratio of omega-6 and 3s. I'm not getting into that, but basically, the more omega-3s you have, the better you are. If for some reason you live in America, which most of our people do, and for some reason you're going to eat processed foods, I understand it. Your way around it is to take large amounts of omega-3. If you don't have any symptoms, we're talking 3,000 to 5,000 milligrams a day. If you have symptoms, we're talking up to 10,000 milligrams a day. That's a lot of oil. So we look at this, what are the silent things that are actually causing us to get sick? Low oxygen. What are the silent things that are actually causing us to get sick? High blood sugar. How do you know if you have a blood sugar problem and it hasn't turned into diabetes yet? You have high cholesterol levels. Cholesterol is a direct reflection of inflammation. So you got your cholesterol levels and they're high. That's just telling me you have chronic inflammation. That's all it's telling me. If you have high triglycerides, it's even worse. It means your blood sugars are not being absorbed correctly. But cholesterol is a direct reflection. Your LDL, your VLDL, your triglycerides are all chronic inflammation. So you have high cholesterol, but your blood sugars are normal, but your A1C is like 5.8, and they're like, well, you're pre-diabetes. That means you already have problems. The fasting blood sugar is only taken at one time. The A1C actually tells us how chronically you've been inflamed. So if you're not below the normal, like low, like 5.5, if you're above that, you have blood sugar problems. And that's causing chronic inflammation. You don't have diabetes, you might have pre-diabetes or pre-pre-diabetes or pre-pre-pre-diabetes. But understand, this is the difference between looking at you functionally and looking at you through a disease process. So what does that mean? If I'm looking at you functionally, I know that if you're not absorbing sugar correctly, you're causing chronic inflammation that is going to lead to a number of diseases, like heart disease and cancer. But if you are absorbing sugar correctly and you do have your insulin receptor sites working correctly, then we're going to see those sugar levels stay correct. If we have problems with that, there's another pathway that we can use called the it's just blanking on me. It's another pathway that can actually activate sugar metabolism. And what it will do is it'll activate sugar metabolism in your brain, in your liver. So you actually burn fat instead of store fat. NADK. So this pathway will actually help it. And there are certain supplements that we can recommend to you to actually activate it. So if I've ever recommended a product called glycin to you, that's to help you more insulin sensitive. And I ever recommended a product called glycoberine, that's to make the other pathway that actually allows you to absorb sugar correctly. So oxygen, silent, makes the symptom happen long-term. Blood sugars, and then the next one is chronic stress that is affecting cortisol, adrenaline, insulin levels. The thing that actually drives chronic inflammation, and it's called NF-kappa beta. It's basically an enzyme in every cell that, if it's activated, will cause an inflammatory cascade, is insulin spikes. So this is why sugar will actually cause the problems. It's not that you're eating sugar, it's that your body can't absorb the nutrients of what you ate. So say you ate protein and you turn it into glucose because that's what the cell uses, and you don't absorb it. That means you can have glucose spikes and get insulin because you're not absorbing it. Insulin is the thing that drives chronic inflammation. Each time you have insulin spikes, you're going to have chronic inflammation. So we do not want those insulin spikes. So we want to keep oxygen under control, blood sugars under control, and our stress response emotional under control. Do you have any questions about what I just explained? We're doing good? Okay. So if we look at this and we go, well, doc, it's just common knowledge that how you feel tells you how healthy you are. I would say, let's question that. How do people feel the day before they have a heart attack? Do they know they have the heart attack? You'll hear this all the time. I felt perfectly fine. I ran all the time. I'm doing the right things. I have a heart attack. Well, why would that happen? Because they have a chronic inflammatory process going on that they're not even aware of. Or, doc, I felt perfectly fine, and then I found out that I had cancer. Chronic inflammatory thing going on again. And then you're physiology will determine which one you're more prone to. So if you're an adrenal body type like me, and how you can tell if you're adrenal is that if your hips are about the same size as your waist, you're more likely adrenal. If you crave certain foods when you're stressed out, adrenals will crave dairy, butter, ice cream, things like that. They'll also crave proteins. And they'll also crave and love shellfish. So those are your adrenal body types. Those people are the ones that are prone to heart disease, because what will happen is the adrenal body type, when they get stressed, they push up their blood pressure, they push up their cortisol levels, they push up their adrenal function, and they push up their cholesterol levels. Whereas, let's say you're a thyroid body type. Those body types are more prone to cancer, and they're more prone to autoimmune. So why does that happen? Well, a thyroid body type is a person that is going to look different. If you're a male, you're going to have really wide shoulders and a small waist. And you're usually very slender. And you're somebody that intermittent fasting was the worst thing ever invented. Because if you're a thyroid person, you need to eat every 2 to 3 hours all the time. But what are the foods that can drive a thyroid body person towards having problems? This is where you have any carbohydrate, specifically pastas and sugars, as well as alcohol. But pastas and sugars and caffeine are what thyroid people love, but literally burns out their thyroid. And you need to understand, all the blood in your body will go through your thyroid every 15 minutes. So it's literally trying to make sure all the hormones and everything are balanced. But if you burn out your thyroid, you'll burn out your energies and you'll be tired very quickly. Another aspect of this is adrenal body types. The adrenals start slow and go high. So in the beginning of the day, the adrenal person is going to be tired, not easy to get out of bed, and they're more of a night person. So they have a ton of energy at the end of the day. Where a thyroid person is high energy, and then by the end of the day, they start crashing. And you'll see this if you feed the body correctly. So I'm showing you this because the foods that you eat can literally drive the problems, because they can cause the inflammation. So if you're an adrenal person, those carbohydrates are not actually negative to you. You can eat the pasta. You just can't have the cream sauce on it. Whereas if you're that's if you're adrenal, you can eat the pasta, but not the dairy on it. If you're a thyroid person, on the other hand, a protein, carbohydrate, more paleo type thing is really good for you, because it'll actually help your energy stay level. These things, the fluctuations in energy, are what will cause inflammation and then drive you towards disease and dysfunction. So if you're somebody who eats food and then gets really, really tired right after it, that tells me you're having an insulin surge, and that will drive inflammation and cause major problems, which can lead to heart disease and cancer and so forth. So you don't have the symptoms. The only symptom you're having is that you're getting tired. Well, that doesn't tell me anything, does it, doc? Yeah, it literally tells me you're having a insulin surge to try to deal with the stress that you're dealing with. Do you have any questions on what I just explained?
How do you know what type of body?
So the question is, how do we know what body type? We have a quiz that you can take. And if you take the quiz, you come in, ask the ladies, hey, I want to take the body type quiz. For females, there are 4 types. For males, there are 3 types. You take the quiz and you'll know really quickly, within 10 minutes of taking the quiz, I can look through it, tell you what it is, and then we can give you your food pyramid. Your food pyramid is based on your physiology and not generic. So certain diets work for certain people, but it's based on how they metabolize food. So if you are a thyroid person, the paleo is really good. If you're an adrenal, the paleo is the worst thing you could ever do. Okay. So when we look at this, what we need to understand is the symptoms we have are literally 0.1% or 1% of what's actually going on. And we can see this chronically in our society. Doc, I feel good, but I had a heart attack. Or you'll hear things like, I'm perfectly healthy, except I take this and this and this drug. To be perfectly healthy, you're taking no drugs. If you're taking drugs, you're not perfectly healthy. I'm sorry if I offended somebody, but that's how it works. If we're having to take something, it's because we're not working correctly. Does that make sense?
Absolutely.
Now, it doesn't mean we can't get you to optimal or as best as you can be. But there's either you're working perfectly and you have all the factors working correctly, like your brain, your digestion, your physiological indicators, or you're not working correctly and you're having to be propped up chemically. And that's what drugs do. So what I want us to look at is the next time we have a fever, don't rush to the idea that you want to break it, because the fever is the thing that kills the bacteria and slows it down and allows your immune system to do what it's supposed to do. Because if you break it really quickly, you're actually stopping your body from being able to heal. If you're thinking you're exposed to heavy metals or toxins or stuff, that glutathione that I was talking about is an easy way for you to get rid of toxins very quickly and keep your body healthy. Understand that the only way we know how healthy you are is if we actually test you. We want to know how healthy your blood vessels are, you do an ultrasound. You want to know how healthy your heart is, you do an EKG. You want to know how healthy your brain is, you do an EEG. You want to know how healthy your stress response is, we do what's called a stress response evaluation, which shows us the stress markers. We only know how healthy you are based on what your numbers are and what your function is, not based on how you feel. If your numbers are right, your function is right, I know you're healing. If your numbers are wrong and your function is wrong, I know you're growing dysfunction. And it's really that simple. It's just that most people have been tricked into believing that how they feel is how healthy they are. And understand, when you go to your medical doctor, that's their job, is to make you feel better. Allopathy means literally treating symptoms. If they make the symptom go away, they did their job. Their job is not to make you function better, it's to make the symptom go away. And when you understand that, then you'll understand why they cut things out or give you drugs, because if you cut it out, the symptom can't be there anymore. If you give the person the drug, you can make the pain or the discomfort go away, but the underlying functional problem is still there. Understand that when you come to me, I'm looking at what is the function, and I have to literally look at the whole stream of effects. Because if we gave you a drug and the symptom went away, but you still have the wrong function, you keep making the same problem, but you just don't feel it. Does that make sense? So what my job is to try to help you function correctly so that you'll heal correctly. That's my goal for you. So if you have a friend or family member who's scared about heart disease, have them come in and get an HRV test. We can literally tell if they're prone to a heart attack with that test. If they're scared that they're going to get some sort of disease or dysfunction, have them get the EEG or the stress response done, and we can actually see what's going on. If they're scared of having dementia or Alzheimer's, you actually have to test the blood sugars. If you have pre-diabetes, you're prone to Alzheimer's and dementia. If you don't, you're okay. Blood sugar is directly correlated to neurodegeneration. You want to live longer? Make your blood sugar stay under control. You want to live longer and be healthy? Make your oxygen be correctly. Walking, breathing good, and if that's not enough, we have different things that can help you increase blood flow to your brain. These are the simple things that literally change your life. To grow cancer is literally decades. An example of something that will help you grow cancer is shift work. Because you're literally changing every 2 weeks, every month to a different night and day schedule, and your body can't get the rhythms right, and it will literally kill the microbiome in your gut. And then your gut can't detox you, and it can't make the right neurotransmitters, and it will wreck your immune system. So there's a higher incidence of cancer, diabetes, and all chronic diseases in shift workers because their body is not a normal circadian rhythm and the bacteria can't grow correctly. And they're not getting enough vitamin D and so forth. So understand that if we want to know how healthy you are, we need to test it and know it. Yes, blood will show some, but the function will actually show us why the blood is doing what it's doing. So if you have a friend or family member who has something going on, just get them tested. If you're scared of something going on, let me know, and we can test to see if it's something you're prone to. If you're scared of dementia or Alzheimer's, we just do a blood sugar, A1C, and lipid panel, and we'll know. Are you normal? Are you dealing fine, or do we have pre-pre? Because we've had patients that come in who are pre-diabetes and can't understand why they can't remember stuff, have chronic pain, and their gut isn't working. Well, I'm just pre-diabetes, doc. Yeah, but you have chronic inflammation. That means you can't absorb the sugar, and you're going to have this chronic inflammatory response going on, and that's what's causing all these issues. So if we can help you get that under control, it'll change your life. So, in closing, test, don't guess. Go based on what your body is functioning, not based on how you're feeling, and you'll end up okay. I want to thank you all for being here, and have a blessed night.